Hi everyone, my name is Judith Gasper. I am a master's candidate at University of New England, and I am here to present my capstone project, which is Does Nutrition Education Intervention Increase Nutrition Knowledge in Adolescent Ballroom Dance Athletes? Here is an overview of this presentation. After a brief introduction, we will discuss the research question, the methods detailing the narrative literature review, inclusion-exclusion criteria, as well as the selection process, which will bring us to the results, discussion, and conclusion sections. Ballroom dancing for some is a form of social activity or performing arts, while for others it is a competitive sport. There is a significant amount of literature available on steps and patterns as well as technique. Research has also been done on social dancers and competitive athletes' energy expenditure and dance injuries. However, the importance of nutrition knowledge and meeting estimated energy requirements seem to be overlooked. Nutrition care and nutrition guidelines for ballroom dance athletes has not been specifically researched. So for ballroom dance athletes, there is a lack of literature on nutrition knowledge and meeting estimated energy requirement, and generally accepted nutrition guidelines and research on nutrition education intervention. Therefore, other sports were used as a basis for this narrative review. The first topic I searched was nutrition knowledge of coaches and athletes. Athletes often fail to obtain optimal level of energy. Therefore, I wanted to have an understanding how knowledgeable coaches and athletes are about nutrition topics in various other sports. I have found numerous articles on this topic, and I listed 4 of them here that examine nutrition knowledge of coaches and athletes. In the first one, by Couture et al., 47 high school coaches completed a questionnaire. It was relating to their nutrition knowledge. The results revealed that less than 30% of coaches were able to answer general nutrition questions correctly regarding carbohydrates and lipids. The second article by Juzwiak et al. Was conducted to describe the dietary practices recommended by coaches who work with adolescent athletes. These coaches were training athletes in gymnastics, tennis, swimming, and judo. And the results showed that all coaches recommended only general dietary practices, and they had no specific strategies. The knowledge test also identified a tendency to overvalue proteins, excessively low-fat diet, and food myths. In the third study by Salami et al., coaches of adolescent athletes completed questionnaires to identify the practices of nutrition advice to athletes and the degree of their nutrition knowledge. They concluded that the coaches were not ready to give advice to athletes and they should undergo additional nutrition training. The fourth one, by Vita et al., was a 3-year longitudinal study, and they examined adolescent female runners, their changes in nutrition knowledge, intakes, attitudes, behaviors, and health status over a 3-year period. These athletes did not receive intervention. The results showed that nutrition knowledge did not improve, the quality of dietary intakes decreased, and incidence of eating disorders increased over the 3-year period of time. These reviews indicate that both coaches and athletes may benefit from nutrition education. This leads us to the research question, which is, does nutrition education intervention increase nutrition knowledge in adolescent ballroom dance athletes? And the secondary question is, does nutrition education intervention improve meeting the estimated energy requirements of adolescent ballroom dance athletes? In order to answer the research question, I chose narrative literature review, which was based on a careful selection of keywords and clear criteria of inclusion of studies. Selecting relevant literature was a multi-step procedure. First, the search strategy was developed, and the key concepts were isolated in the research question. They were athletes' nutrition knowledge, athletes meeting or not meeting energy requirement, nutrition intervention increase or does not increase nutrition knowledge and frequency of meeting energy requirement. Then search terms were developed, and the following terms were searched: nutrition knowledge, nutrition education intervention, nutrition counseling, and meeting energy requirement. To ensure the search quality and relevance, each term was searched combined with the term adolescent athletes. Then the next step was to apply these terms in the library search, and the following databases were used: Sport Discuss, ProQuest, eBook Central, Science Direct, Biomed Central, ProQuest, and Google Scholar. Now let's look at the inclusion and exclusion criteria. When I selected articles, I wanted to make sure that the objective of the included articles fell under the scope of one or all of the following: nutrition knowledge of athletes, meeting energy requirement, and nutrition education intervention. Then the intervention had to target adolescent competitive athletes of any sport. Since ballroom dancing is an internationally recognized sport, I considered literature from different countries. However, only English language articles were selected. There was no prerequisite for athletes' health status. And in the study design, I was looking for nutrition education intervention through pre-post test with intervention and control group. The size of group was a minimum of 10, and the relevant articles had to be dated 2000 or after. And let's look at the exclusion criteria. Studies were excluded when the language was other than English, when there was no nutrition education intervention, when athletes were diagnosed with disease or had nutrition-related problems or critical illness, when the study size was less than 10, and if the article was dated before 2000. The Prisma flowchart shows the selection process. After conducting database searches, a total of 899 records were identified. 795 were excluded for non-relevance, and 104 were assigned for eligibility. After removing the duplicates and the full-text studies that did not meet the inclusion criteria, a total of 20 studies were included in the final review. Here you can see a summary of the number of articles found for evaluation in each database. As it shows, Sports Discuss and Google Scholar resulted in the most, 7 each, Science Direct 4, Biomed Central and ProQuest resulted in 1 article each. Once the 20 studies were identified, the following information was extracted: the aim of the study, settings and outcome, sample size, the description of the intervention, and the theoretical foundation for the nutrition intervention. This information was organized in a table, which is a useful tool for synthesizing the components. In order to fit this screen, I broke it up in 4 tables. So this is table number 1. You can see the first 5 articles. Then in the second table, you can see the next 5 articles. Here comes table number 3. And here's table number 4 with the last 5 articles. And now let's look at the results. In a summary, the review identified 899 articles, of which 20 met the inclusion criteria. Each of them hypothesized that nutrition intervention would improve the studied behavior. Intervention was adequately described in 18 studies. Intervention duration was 1 week or longer in 15 studies. In the original review strategy, I wanted the nutrition intervention to be longer than 1 week. However, I found limited number of studies with nutrition intervention. Therefore, this criteria was not included in the final review strategy. The sample size was more than 10 in all 20 studies. Theoretical foundation for nutrition intervention was specified only in 3. Inclusion-exclusion criteria of participants was specified in 13 studies. And before and after statistical comparison was completed in 19 studies. Of the 20 studies, 11 showed significant increase in the nutrition-related interventions. 8 showed positive results, but not significant. And one of the studies did not show positive outcome on nutrition knowledge. However, it was only a one-time intervention. To assess the quality of the identified studies, a quality rating scheme was adopted based on the structure of ROBIS and INSA and was modified to suit this research study. ROBIS is a tool to assess risk of bias in systematic review, and INSA stands for International Narrative Systematic Assessment Tool. Table 3 explains the rating scale scheme. This is an easy assessment tool to rate and compare the relevance and strength of each article based on these criteria, such as intervention adequately described, intervention duration is at least 1 week, study size is larger than 10, theoretical foundation for nutrition intervention specified, inclusion-exclusion criteria specified, and there was before and after statistical comparison. Based on these criteria, a total score was given to each article, which you can view here in this quality assessment result table. We can also have a summary of number of studies and their scores. We can see that 3 articles received 6-star score, 7 received 5, another 7 received 4, 1 article received 3 stars, 2 articles received 2 stars, and 0 article received 1 star. So we can see that majority of the articles, 17, received 4 or higher score, which is showing the relevance and strength of the article. This leads us to the discussion. The review identified 20 relevant articles that met inclusion criteria. However, none was targeting ballroom dance athletes. When search was conducted with search terms identified earlier, and they were combined with the terms ballroom dance or ballroom dance athletes, no results were found. This suggests that there is a gap in research. There is no literature available for ballroom dance athletes on nutrition-related topics. Despite the most commonly reported outcome of increased knowledge and behavior change, it cannot be concluded that nutrition education intervention increases nutrition knowledge and the frequency of meeting EER. This suggests a second gap. There is not enough studies done showing that nutrition education impacts nutrition knowledge of athletes. Overall nutrition education contributes to changing food and nutrition-related behaviors in athletes. However, more research needs to be done in this area to enhance the quality and amount of evidence that support that nutrition education increases nutrition knowledge of athletes in various sports, and including ballroom dancing.